Hey there, and welcome to Connect the Dots Learning Center podcast. I'm Stephanie Wagers, your host, and I'm so glad you're here. Whether you're a seasoned therapist, clinic owner, or just starting out, this podcast is your go to spot for insights, tips, and stories that'll help you connect the dots in your practice. Hey, welcome back to Connect the Dots Learning Center podcast. Today, I'm joined by pediatric occupational therapist Bonnie Goenig. She brings over 40 years of experience to the table. We're diving into why pediatric therapists need to blend different clinical lenses to truly understand and support the kids we work with. Bonnie has a ton of stuff to offer, and we're excited. We're going to be doing a 3-part series. You're an occupational therapist that brings multiple lenses to the table when working in pediatrics. So if you want to give me kind of the quick version elevator speech of kind of who you are, your background, and what brought you to doing what you're doing today.
Sure. Thanks for having me, by the way,
Yeah.
Stephanie. I appreciate it. I have been a pediatric occupational therapist for a little over 40 years. And my initial kind of interest in pediatrics was working with children with complex disorders, which is still my love today. So clinically, I was searching for additional information, and through continuing education, I got my neurodevelopmental therapy certification, and then I went on to become a neurodevelopmental therapy instructor. So I teach in the pediatric certification courses, as well as teaching advanced courses for NDT. I also went on to get my sensory integration certification, and I have a deep interest in a lot of manual therapies. And so I've done a lot of training and work with manual therapies as well. I've worked across different settings, so hospitals and schools, and most recently, about 18 years in a nonprofit in more of a leadership position.
Okay.
And what's brought me to what I'm doing currently, I left that position in May and developed a private practice. Really, at this point in my career, I wanted to blend everything that I've learned and that I use in my treatment. And my private practice, Wave Crest Pediatric Therapy, is really designed to be able to support parents and families and really integrate therapy into across environments, to be able to collaborate and coordinate with professionals for the child that really, has complex needs,
Right.
and actually, that's complex needs in terms of neurological, but we also know that the children who have behavioral and sensory based kinds of issues can be very complex.
Yeah.
So,
Wow. So you have extensive training, and it also means you've got that really big black box, right?
mhm.
Have you ever used it for the SIP? If you haven't been SIP certified, you come out with this huge black suitcase.
Yeah, yeah, I do have that.
I just gave mine to Goodwill.
I know, I was going to say, if anybody wants it.
I know, it's like, what do you do with this?
I
Yeah,
know, I know.
yeah,
But it did give a good foundation of knowledge,
absolutely. And
and
that's what
that's
I loved
what's
about it too.
important.
So when you say like integrative therapy, what does that actually mean in pediatric practice?
Well, when I talk about integrative therapy, and when I use what I consider to be integrative therapy, it's not just a layering of techniques. It's
Mhm.
more about clinical reasoning. It's more
Mhm.
about knowing the systems of the body, having a real strong knowledge about how things interact, and
Yeah.
how all of our systems are interconnected and influence each other. And so when I say integrative therapy, I really am referring to needing to appreciate and honor that there are contributing factors beyond sometimes what we're seeing as a functional deficit.
Makes sense. I know sometimes we take on a lot of students at our clinic, and a lot of their questions are, "Well, what frame of reference are you using right now?"
Mhm.
And I'm always like, "I have no idea." Like, I my brain doesn't think that way. Talk a little bit about what tends to happen if a therapist is just using kind of one lens to treat a patient.
Yeah. Well, I think if you come in with one lens, that to
Mm,
me means that you have one framework,
yeah,
and there you have limited tools to your disposal in terms of the approaches that you can use and draw on. And I think what happens there and what I've seen is that you really plateau, the children plateau.
mhm,
And because we're missing contributing factors that are key to
mhm,
moving them beyond, where they're at.
mhm,
At a certain
mhm,
point, a single lens, a single approach can work. But
mhm.
I think at some point you need to bring other lenses in, you need to bring other approaches in to move beyond a plateau.
Yeah, I feel like, and maybe you can speak to this too, sometimes our educational system doesn't do, they do a great job of teaching the frames of reference, but I don't
Mhm.
feel like they do a good job of when do you blend them,
Right.
right?
Yeah, and I think that comes down to knowing, knowing, having knowledge of evidence-based kinds of strategies. And I think what we're missing sometimes with clinicians that are strong in that way, but maybe not so much in how they make clinical decisions on the spot. I
Mhm.
think observation is a big piece that we're missing. You
Yeah.
know, observing and understanding what those observations mean, and then making clinical decisions, the whole clinical reasoning
Mm.
behind, what we're seeing, and then how we're going to approach it to impact and create good functional outcomes. So,
Right.
I think thinking about that too, though, if as a clinical director for so many years, we've had a lot of students coming through and then hiring new grads. And what I think has happened too, just systematically, is
Yeah.
that those new grads come in with very high productivity demands. The
Mhm.
system itself is not supporting as well as when I was a young therapist. Mentoring and, having somebody available to walk you through some things before you have to jump into a big caseload. So
Mm.
I think it's twofold. I think, on one end, I think the universities have moved in their curriculum more towards strict evidence-based kinds of
Yeah.
criteria. I mean, as occupational therapists, especially as an NDT therapist, we have, because NDT has not always been extremely valued by curriculums in the university, um, and it's hard to publish. And
Mhm.
so, we're not in a lot of evidence-based
We're
um,
not.
publications. And so, yeah, I think as I work with new clinicians coming in or clinicians who are seasoned but are new to pediatrics, really make sure that they have a breadth of knowledge in a real sound foundation in clinical observation,
Yeah.
and and then being able to tease that out and really have some good clinical reasoning about what to pull on and what to draw
Mhm.
on to impact.
Mhm. Yeah, amongst everything that the child and the family brings, right? It's not just like the perfect
Right.
situation that we talk about in school, and we're not just looking at
Absolutely.
this unique child. It's like family, child, and I think that that's where that confidence piece really takes a hit. What I've noticed in our own clinic is they're trying to balance families' questions, observations,
Hmm.
behaviors of the child, and it's just like it can feel like you're a monkey in the middle or kind of doing a circus at times.
Right. Right.
Yeah.
And yeah. And there's so much, I mean, the working in a clinic, you get a snapshot.
Snapshot.
a
Yes.
snapshot of the day, a snapshot of the week.
Right.
And that's, one of the reasons why I built my practice like I have. I do have an office setting, but I go anywhere the child needs support. So,
Right.
and that's a luxury.
Right.
But
Yeah.
I think it's a really important piece to see
Mhm.
kids across environments. Or, the kids that we treat spend so many hours in school,
Mhm.
and they spend, so many hours with their family. We have them for an hour sometimes a week.
Right.
I'm really a big proponent on looking at a continuum of therapy across, lifespan, yes, but also
Yeah.
across the plan of treatment. And sometimes they need more and sometimes they need less. And
Mhm.
when you talk about the bigger definition of integrative means integrating it into where they're living and where they're needing to bring those functional skills.
Yes. Yeah. I feel like that is a big missing piece
Hmm.
often in especially outpatient peds. It's like we're just thinking we're doing what we're doing, and then we're going to grab this exercise sheet and give it to the parent.
Hmm.
But if it doesn't work and integrate into their home life, it's as good as going into the trash, right?
Right, right. And sometimes the kids come in after school and
They're
they're
tired and
tired, and so you don't have them in the best regulatory state to begin
right,
with. And so sometimes our sessions aren't even as productive.
right. I always tell my therapist, like especially with the eval, when they're newer, you don't have to nail it. You're not going to see everything.
Hmm.
You just
Right.
need to it's a snapshot. What of that snapshot can we address? And then write to that, and then just keep, pulling back the layers of the onion
Yeah.
to get more. Yeah.
I'm exactly on that page. That's exactly what
Mhm.
I tell my therapist.
Yeah.
This is a
Because
snapshot in time, but make sure you do a really good comprehensive kind of questionnaire with the parents.
yes. Yes.
And make sure that have them sign a release so that you can talk to the school-based therapist or, the other clinicians that are working with this child. Because usually with the children we treat, no matter what their disability is or what their diagnosis is, they have a plethora of people who are involved in their life. And I think
Right.
it's so important to make sure that we coordinate services.
Let's talk about choosing the lens that you're going to treat with.
Mhm.
Like speaking to newer grads, what advice can you give to them about choosing the lens, transitioning that lens, layering it?
I think, the first thing would be watching the child move
Mhm.
and watching and bringing to that observation your knowledge base about what might be impacting that movement.
Mhm.
And when you do that, it's going to broaden your lens so that don't come in with just one frame of reference. Come in with the option that this is an opportunity to really, learn what's happening, so that you can bring to them whatever they need in terms of, an approach. So,
Mhm.
you know, talking about different frameworks, I think there's a distinction between frameworks and approaches,
Mhm.
where for me, I have a variety of different frameworks. I think frameworks bring like how you look at things. And
Mhm.
then the approaches from that are different ways that you've learned in different career, like different continuing ed
Right.
and from different mind thoughts or so for me, I have the framework of neurodevelopmental therapy and sensory integration. And so neurodevelopmental therapy gives me posture and movement and a way to look at that and a way to
Mhm.
approach that in treatment. But that doesn't discount that in that posture and movement, there are sensory regulation pieces. So
Right.
sensory integration from a framework gives me that information when I'm observing movement.
Mhm.
So
Mhm.
if you can bring to your observation a, a few different ways of looking, bringing sensory integration, NDT,
Right.
what's restricting those joints, and they are manual therapy you can, bring in, or range of motion. Um, then you have to your disposal a variety of different ways to approach
Hmm.
the therapy.
Yeah, that makes sense. And if you could speak to, the newer grad, what should they get their education
Mm,
in first? What is going to be their biggest bang for their buck? Because there's so many courses out there.
I know, and it's overwhelming.
It is.
It's
It's like,
it's
where do I even start?
It is. It's so overwhelming. And when I teach a lot of courses on a lot of different topics, and I do teach some blending, topics.
Hmm.
So
I
NDT and
love that.
myofascial release, or,
Yeah.
whatever. But when that's something that I get often, are people coming back up to me after my class or after my course and saying, "What's next? What's next?" And, for me, I have always thought that neurodevelopmental treatment has given me such a great foundation and platform to observe movement. I
Mm,
always encourage new therapists to at least take an intro to NDT,
yeah.
to really understand posture and movement, and that piece of it. Um, but when I'm asked, like, what's next, say I teach an intro to NDT and somebody runs
Yeah.
up and says, "What's next?"
What's
I
next?
say, take this information back and use it. And, and start integrating for yourself this piece, and
Hmm.
you will become aware of what's next for you. Like, what pieces might be missing
Hmm.
that are impacting your successes in treatment, and then that's next. So
Right.
it's overwhelming. Back when I was a newer grad, there weren't as many continuing education
No,
opportunities.
there weren't. I mean, they're all over the map. And I feel
They
like
are.
OT has gotten so broad
Yeah,
that we can't be good at everything. We just can't be knowledgeable
right.
about everything. And I think we need to pick our lanes, get
Hmm.
really good at our lanes and see what fits in there and then refer out.
Yeah.
Yeah.
Well, and OT has always been good at looking at functional daily skills, right?
Yeah.
That's who we are. And each functional daily skill, each complex functional movement has a lot of different pieces to it.
Yeah.
That's why
Sure
we
does.
feel like we've gotten broad. But if you always bring it back to function, if you always bring it back to that functional task, and that helps you narrow the scope of what you need to do at the moment. I tell the young therapist, really, uh, go to what's most, like, interesting to you. Start
Hmm.
there, and then know who in your network is good at the things that you don't know enough about right now to feel confident that you're doing what you need to do. You don't need to know everything to apply everything. You just need to know enough to know what's missing, and maybe who to connect
Yeah, that's a great point.
to bring that piece in. So, I think OTs generally are pretty humble, and we don't
Yeah.
profess to know everything. And
Right.
and I think we're a good team member in that way. We're also, I think, if we keep the focus on, the doing the best for the child, doing the best for the family, then we're okay saying, "Gee, I don't know that.
Yeah.
Let me
Let me look
let
into
me
that.
either, yeah, find that out for you,
Yeah.
or, there might be somebody that I can refer you to."
Yeah. Can we talk just a little bit about NDT, sensory integration? And that is not where I'm seeing people lean. Like,
Mhm.
I personally have never had one of my therapists that work in our clinic be NDT trained. Not that I wouldn't 100% support it, But why are they moving from, sensory NDT into more trauma courses?
Yeah, I think it has to start with the curriculum in the schools, really. And I know that over the past years, there's a lot of emphasis been on evidence-based,
Mhm.
and that if it's not evidence-based, then be careful in how you apply that. But
Right.
again, I think um, we there's still a lot we don't know about the human body, even though
Mhm.
we know a lot and technology has helped us to know more. But we know what works. And so
Yeah, I know.
sometimes it's hard scientifically or empirically to to have some kind of a study that proves that, because, and especially with the kids we work with,
Right.
because there's just not a homogeneous group. And in order to do a real good empirical study, you need a very
Yeah.
homogeneous group.
Yeah.
But to your point about trauma informed and all of that, I think also we that's what the environment is, right? I mean,
Yeah, you're right.
and there are more and more children that are becoming diagnosed with autism. And
Hmm.
so I think there's been an emphasis on what can we do to help those children.
Hmm.
There are lesser children that have complex, like cerebral palsy kinds of issues, medical issues, because of thank goodness for
Right.
the technology and the, prenatal and the, postnatal for kids that are preemies and whatnot. I think, that perhaps we're seeing more emphasis on the trauma informed aspect and the regulation and
Hmm.
behavioral, really. What is your impression of that?
I agree with you 100%. I think I went back and got my post-professional doctorate in 22, and what
Hmm.
a shift, right? Like we
Yeah,
didn't do research the way that you can do research
right,
now.
right.
And it was frustrating in the way of like, I know this works. I've seen it
Hmm.
work so many times. And then they're like, well, there's not the evidence for it. And it's the
Right.
same thing you're saying. We don't have these groups and these populations, and we're really, you can't do a research project on this. It doesn't work.
Mm-mm. You can do case studies, and a variety of case studies can add up to, you know,
Right.
being being something that says, yes, this works. But
Mhm.
even at that, I mean, it's the therapists themselves doing the case studies don't have either the research background
Right. Or
or
they're making them follow this like certain path. And it's
rigid
like,
protocol.
that doesn't work.
No, right.
Yeah. And I guess where I get disheartened is I feel like progress is so much slower
Hmm.
when we're not blending SI and other treatment
Hmm.
modalities in there. And I see a trauma kid and I'm like, you better be approaching that with SI.
Hmm.
But
Absolutely.
I see people playing in rice bins and I'm thinking, we're not a therapist here. We're not a mental health
Yeah,
therapist. Let's get to the bottom of the regulatory
yeah,
skills.
yeah.
Yeah.
And we do have mental health background. I don't know what the
We do.
curriculum, but that's not, I mean, it's not our
No.
focus. But I really agree with you. I mean, I think it's we can't throw out what we know works
Right.
because somebody has not created a study to prove it.
Mhm.
And I've always operated like that. I mean, the fact that I love NDT and became an NDT instructor, I know that works. I know it works.
Yeah.
And but not in isolation.
Not in isolation. No, nothing works in
Nothing
isolation, I
works in
don't think.
isolation. That's where, that integrative concept comes in, right? So
So tell me a time where you might use NDT where people would never think about using it.
you can play NDT anywhere. I mean,
That's what I'm thinking, right? Yeah.
absolutely. I mean, so all of these children with diagnoses of autism,
Mhm.
They have postural weakness.
Mhm.
They have proprioceptive deficits that are not allowing them to respond to
Mhm.
environmental demands as they, as easily as they could from a balance standpoint or a reactionary standpoint because they just don't have those postural reactions. I think that for many of those kids, well, I can tell you, I'm working with one child right
Yeah.
now who um, he's 11 years old and he has not a diagnosis of autism, but he has ADHD. And so if we only looked at treating his attention deficit and his lack of regulation for emotional responses,
Mhm.
we'd be
Mhm.
totally missing a boat. My treatment with him currently is working on postural strength, on core strength, on especially upper body
Yeah.
strength and coordination because his hand skills are a mess.
Right.
And so that causes frustration, which increases his stress, which it's just
Yeah.
a snowball. And
Right.
you have to get down to looking at everything and figuring out what is going to make the most impact at this moment in time.
Mhm.
And so that, that now, am I ignoring everything else? No, because it's it's all
It's
combined.
all
I mean,
encompassing. Yeah. Yeah.
in the NDT curriculum, there's PT, OT, and speech that teach
Yeah.
that course. And so I team with PTs and speech.
Yeah.
And as the OT, one of the things I bring to that course is that whole sensory integration piece. But we because of our knowledge in sensory integration, we have a better appreciation for what those senses are all about and what the impact is if you have deficits in either receiving that information or processing that information.
So, biggest takeaway today for younger therapists that I'm hearing is start with what you're interested in, do some coursework around that, take that back, integrate it, and then figure out what do I still not know,
Yeah,
and
yeah.
then get some coaching around that,
And find a
and
mentor.
find a mentor.
Mentoring is a big piece, and that's how you learn about what it is that you don't know is
Mhm.
by somebody giving you feedback, and being open to that feedback is gold.
If someone's listening and they're like, "Oh, I really want to find a mentor,"
Mhm.
where would you recommend them looking?
Oh, well, my organization here in Ohio, the Ohio Occupational Therapy Association, and I'll talk to my state organization. I don't know about other state organizations, but we have a priority in our strategic plan for the next 3 years to develop a mentorship program.
Mhm.
And so we have therapists who are volunteering to be mentors.
We're going to do a little tease into next episode, which we're going to talk a lot more about manual therapy. And you and I have kind of talked a little bit about
Yeah.
why it's really misunderstood in pediatrics. I feel like, especially with OT, we don't tend to do a lot of manual therapy. Why do you think it creates such strong reactions in people?
Well, I think if you haven't been trained in it and
Mhm.
you don't know a lot about it, it might be things that you've heard or things that you've seen. And I think when you don't know about something, sometimes it sounds risky and you kind of veer away from it. And so I think learning more about it is a big piece. And the more you know, the more you can be okay with what it brings to the table.
Right. And so if you want to know more, next time we're going to be talking about what it is, what it isn't, and how manual therapy can help. So
Mhm.
it's been a pleasure to talk with you today, Bonnie. I really appreciate all your knowledge and just kind of opening our eyes to why we need to blend lenses and almost to take a step back and look at what we're doing and then hone in from there.